For those of you who haven't met me, I'm Alyssa Poulos. I'm one of the new oral surgeons at Armitage. We're so excited to have Dr. Hobson join us tonight to start off her lecture series with us. If any of you are new to joining this lecture series, Dr. Hobson is an amazing physical therapist. She's really revolutionized certain aspects of physical therapy with her techniques in dry needling. She works a lot with TMJ patients, chronic pain, migraine patients, so a lot of patients that we see on a daily basis. And I know I'm really excited to hear her lecture, to learn new things to implement for not only my patients, but also myself, our staff, because with the kind of field that we're in, I think we could all benefit from physical therapy and learning some techniques that she has to share with us. So Dr. Hobson, I'll let you get started. Thank you so much.
Awesome. Thank you so much, Dr. Poulos. Katie, are we recording right now?
Yep, we're recording.
Wonderful. Okay. All right. Welcome, everybody. I'm so excited to be here, especially with my dental colleagues. This is something I'm very passionate about, and I've had issues myself with breathing, so that's why I'm really wanting to share this with as many people that look in people's mouths, which I think a lot of dentists look in people's mouths just like I do. I'm a TMJ physical therapist. I'm also a myofunctional therapist. So if many people might not know what that is, it's like tongue training, it's airway training, it's nose breathing, it's proper swallowing. This is our vital, center of our life. And sometimes we get into bad habits and we use it improperly, and it causes all kinds of a cascade of problems. So I'm here to share, and I want you to kind of take off your doctor's hat and be a patient for a moment, because I learned so much when I was going through this training that it was more for me, I realized, because I wasn't breathing right. And here I am, a TMJ, head and neck PT. Everybody needs this education. So I'm glad that you're here. The first first session is all Buteyko, and Buteyko is based off of Dr. Konstantin Buteyko's work. He was a medical doctor from Moscow that was able to monitor breathing volumes of patients as a practical assignment, and he discovered that the sicker the patient was, the heavier they breathed. And that was kind of a ha-ha moment for him. And in even 1952, he was able to reduce his own high blood pressure by practicing very simple, gentle, reduced breathing exercises. So what are we going to learn this day? It's a lot. It's a lot of information. I'm not expecting you to do everything, but just kind of come away with learning a few things that might help your sleep and your daytime energy. So we're going to learn how to assess our own breathing. We're going to do some exercises to unplug our nose. We're going to work on nasal hygiene. I never used to clean my nose, and I don't know if everybody here does clean their nose, but cleaning your nose is very important because the nose is where it's at. We need to breathe through it. We're also going to learn how to reduce our breath rate in many different ways. You're going to end up picking your favorite. You have a supply list, and one of the things I'm going to ask whoever wants me to send, and maybe I can send it to you, Katie, and you can share it, but there's a supply list of things that we're going to go over today, and then you're going to get your own and try it at home. But these are little little gadgets that we use to help our breathing. We're going to learn how to tape our lips. So I don't know if anybody tapes, but taping my lips has changed my life and my energy level. So I want to share that with you. We're also going to train our breathing while walking with our mouth closed. We're going to train our breathing to improve anxiety and coughing attacks and panic attacks. And we're going to do a different degree of breath holding and sitting. We're going to do also different degrees of breath hold walking exercises. And then the very most efficient, if you can do it, there are some precautions, is the Buteyko steps exercise. So that's our objectives. One thing people don't realize is that for 1 minute of breathing, we bring into our bodies 4 to 6 liters of air, which is normal. That's The minute volume should be about 4 to 6 liters of air. Then what people don't realize is that if you have asthma, if you have sleep apnea, that volume changes per minute. And you'll notice for asthmatics and sleep apneics, it's up to 3 times the volume. And that's what people don't realize. They think, oh, sleep apnea, I was snoring, I got my sleep test done, and they said I need a CPAP. Well, that just kind of blows open the airway so that it doesn't collapse. It's important, but it's not changing anything. What I'm going to try to teach you is how to reverse these bad diagnoses that we get. We can reverse our body. We can, if we direct our body to work properly, we are going to have a good outcome. But if you don't know, you're not going to be able to change anything. So I'm hoping if you have asthma, if you have sleep apnea, the Buteyko system, that program is the best. And it does take some time, but it will reverse your symptoms and it'll reverse you from having it. And I've had many people off asthmatic steroids because of these simple exercises. So what are the traits of dysfunctional breathing? You got mouth breathing, that's number 1. And listen, some people think they don't mouth breathe, but I was a mouth breather for 35 years and I didn't know it. So, and I'm a high narrow palate patient, you know, and I had my bicuspids taken out. My jaw was set back. I had, you know, a class 2, and I was tongue tied. So there was a cascade of things that make you kind of a mouth breather or prone to it. And then when your nose ends up getting narrowed, then it's hard to breathe through it. So you end up mouth breathing. So chest breathing is another one, fast chest breathing. I see that a lot in my patients. I see a lot of head and neck patients that come in with TMJ pain. And that's the reason they actually have a motivation to come in. But the root of their problem is their breathing pattern that pulls their head forward and positions their jaw and their condyles in not great positions. And then they start to develop you know, compressing the bad part of the joint, which is the posterior part that hurts. So all of this, if we can restore proper breathing and proper mouth posture, we're going to talk about mouth posture, we're going to talk about spinal posture. That's more in session 2, but we'll talk about it a little bit today. So audible breathing is bad. If you can hear your breathing while you're working on your computer, that is bad. If you hear breathing at all, you want to be like one of those little babies that you can't tell if they're awake or not because they're so silent. That's who you want. You want breathing to be silent. If you sniff a lot, if you clear your throat a lot, if you think when you talk a lot, if you take big breaths before you speak the next sentence, and you'll see that I'll pause a lot and I'll take a breath because I used to blah, 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 everything out and then suck air and blah, blah. So it's mouth breathing the whole time. So watch yourself. If you know that you talk a lot, you've got to take breaths through your nose and pause in between your talking. Yawning, huffing and puffing in the morning. Okay, so if you have a spouse that is, the whole morning, chances are they're not breathing well all night and all day. Those are my, sleep apnea is a day and nighttime problem, just like asthma. It's not just, let's fix it at night. It's a day and nighttime problem. So we need to learn how to address it. Okay, traits of good breathing. Very simple. This is not a very difficult program. It's through the nose. It's breathing slow, slowing down your breath. Breathing low. What does low mean? So the lower part of our lungs has the most blood gas exchange. And it's the most economical and the most efficient. So you want to use your nose, you want to breathe slow, and you want to breathe low. So here's an example of gas exchange and how to improve alveolar ventilation. So we've got 3 different types of people. We got someone here breathing a respiratory rate of 20, 12, 6. So those 3 people are what we're going to talk about now. And hold on one second. So the first individual is taking about 20 breaths per minute into their body because the respiratory rate is quick, quite quick. This is in 1 minute. And the tidal volume is 300, which is the size of each breath. The MV is the minute ventilation, which is the amount of air that you bring into your body in 1 minute, which is 6 liters. So when you're taking in 6 liters of air into your nose or your mouth, it doesn't mean that the entire 6 liters gets down to the lungs. There's a certain amount of air that every breath that you take stays in your nasal cavity, in your throat, in your trachea, in your bronchioles. There's part that gets lost in dead space. Of that, if you take 20 breaths, half of it gets stuck in dead space. So if you notice here, you have 20 breaths. This is the tidal volume, and the minute volume is 6 liters. So 150 mils gets lost in dead space. That's your dead space. So how much do we actually ventilate and gas exchange? Is 3 liters. So now you've got person number 2 that's breathing 12 breaths per minute. And this has an increase in tidal volume proportionately to 500 mils. We're still taking the 6 liters of air in per minute, but because the reduction of the respiratory rate, there's an increase in alveolar ventilation from 3 to 4.2 liters, which is a significant change. So if we go one step further, we have a patient that breathes 6 breaths per minute. And that allows the size of each breath to increase proportionally to 1,000. So you see here, you're still getting in the 6 liters of air per minute, but we've reduced it from 20 to 12 to 6. And now you're reducing your breathing, but in turn you have to increase the volume of each breath. You don't want to overbreathe, but you also want to be able to get enough air in and out. You're still getting the 6 liters that you need. You're only losing 150 from that 1,000. So you're ventilating 5.1 liters of air. So this is a significant increase from the 3 liters that you see here. Okay, so I hope that's clear to everybody. All this is an increase in oxygen uptake, and it's being smart about what you know about breathing. So in order to prevent blood oxygen desaturation, it's important not to breathe fast and not to breathe shallow. Okay, so what's the importance of nasal breathing for sleep? What are the risks of mouth breathing? So the risks of mouth breathing, you have snoring. So if you snore, this program will help you. So you want to know that if your mouth opens, your tongue drops, and you end up snoring because your soft palate drops. It also gives you a higher risk of obstructive sleep apnea. This applies to children, to teenagers, to adults. It doesn't matter the age. We don't have the statistics of how many children mouth breathe during the sleep, but the studies are suggesting 25 to 50%, which is huge. For adults, though, if you're 40 years of age or more, you are 6 times more likely to spend 60% of your sleep time with your mouth open. So if you all haven't learned about taping, it will make you so much healthier, and we'll go over it in just a moment. What happens during mouth breathing? So your mouth will dry out and your throat will dry out. And as the moisture is driven out of the airway, this leads to an inflammation of your airways. As the airway gets inflamed, it will then get narrower. As the airway gets more narrower, it creates a greater resistance to breathing during sleep. So what is hypopnea, apnea, obstructive sleep apnea? That resistance to breathing during sleep that we're talking about increases the partial collapse of the airway, where the throat can collapse partially to cause a reduction to the flow of breathing, which is hypopnea. So hypopnea, it lasts for 10 seconds or more, and it will drop your oxygen saturation by 3 to 4%. And apnea, is a total complete collapse of the airway, and obstructive sleep apnea is a total complete collapse of the airway that'll stop you from breathing for at least 10 seconds. So sleep disordered breathing, what are the negative issues to sleep disordered breathing, such as the snoring, the hypopnea, the upper airway resistance syndrome, which I'm sure I have. I'm very narrowed in the nose, and I ended up having a septum surgery to help me open up my nasal passages. So anytime you're narrowed here, it causes resistance. Also obstructive sleep apnea. How does it all affect your sleep? It will cause some sleep fragmentation. If you are constantly getting aroused during sleep and not getting into deep sleep, you're likely not to wake up refreshed. So open mouth breathing increases your risk to getting sleep apnea. So, and now I'm going to stop my share for a second. So I'm going to show you, hang on a second. Here we go. So the tongue, can everybody see this? This is like the side view of your face without your face on there. And so you have your tongue that supports your mouth and your soft palate and your airway. Your airway's right here. And if you have your mouth open, the tongue is likely not to rest on the palate. The tongue should gently be not pressed hard on the palate, but gently resting on the palate. As the airway can collapse, the soft palate and what ends up happening is that the soft palate will fall into the airway here. So this is the soft palate here. Anywhere that you see kind of a purpley maroon color is muscle. So that soft palate can fall into the airway. Your tongue can also fall into the airway, especially if you're sleeping on your back. Not good to sleep on your back because the tongue just with gravity will fall into that airway. And then the epiglottis is an area that there may be a collapse right down here. And the throat itself can collapse. Let me share real quick. So let's see. So mouth breathing. Good versus bad size of the airway. So it'll cause the mouth to dry out. It'll cause the architecture of the upper airway to get narrow. This will cause also the jaw to fall back. This is what happened to me with my breathing. I got a deviated septum. I got narrowed here. My jaw sat back. I became a class 2 patient. If you have good nose breathing during growth and development, as you all, I'm sure you've learned, Dr. Kevin Boyd is amazing at this. You want a forward mid-growth of your face. You want your face to grow forward so that your nose is not a bulldog nose that is stuffed into your face. You want a nice, large base of your nose so that you don't have a septum that bends. So a good airway is actually the size of your thumb. A poor airway is the size of like a pencil, like a pen. So you want a big, thick, wide airway so that you don't have airway compromise and issues with clenching to try to open up your airway. The narrower the airway, the greater resistance to breathing and the greater risk of collapse of the airway. So mouth breathing affects it. What does it do? It causes more of a faster, shallow breathing, more chest. It also reduces your lung volume. It will cause a throat collapse more easily. So when you are obese and if you put on weight, your tongue actually gets fatter. Your tongue will get fatter and it'll occupy more space in the mouth and the throat. Your fat pads in your throat will also occupy more space. So that's just talking about right here. But what happens when you get big in your tummy, right? So we have the diaphragm. I'm going to say, the diaphragm is right under your rib cage. And if you got a pop belly because you're obese and you've gained all this weight, you stop using that diaphragm. And that diaphragm is the major muscle for breathing. So if you're not using the major muscle for breathing, you're going to be in trouble. Let's see. So deep breathing means diaphragmatic breathing, not big breathing. So we're going to be doing a lot of different breathing exercises very soon, but know that we've got to make sure our nose and our nose is working, our tongues are in the roof of our mouths so that our airway isn't getting compromised by our tongue falling back, and that we're using our diaphragm. So to keep our airways open, what do we need to do? For sleep, to maintain an airway open, that the muscles in the throat are designed to keep the airway open, we need to nose breathe. We need to light breathe. We need to slowly breathe. And we need to deep breathe. This is not hard, guys. This is like, but we get sidetracked and we get busy. And our minds go somewhere and we're, trying to get, I think Americans try to get way too much done in one day. Like it's not possible. And guess what? Our breathing gets compromised when we push ourselves. So just a couple more things about snoring. So open mouth snoring. I ask many of my patients to make a snoring sound. They make an open mouth snoring sound. We take care of that with just taping the lips, right? So it's nasal snoring. Here's when you hear first, the mouth snoring sounds is like, so if you close the mouth, that tends to go away. But what happens with the nose when you feel that? It does not feel good. What are the factors in snoring through the nose? It's flow and airway size. Two different things. Now try to make that sound of a snore. What do you feel when you make that sound? So you'll feel like a rush of air sucking in, right? So it's a big volume breath and kind of a collapse of the walls of your nose. So by making the size of the airway narrower and increasing the flow, you are increasing turbulence in the airway. So what I want everybody to do is practice right now. Put your tongue in the roof of the mouth. You're going to put your tongue in the roof of the mouth in the end. Say N, and then close your mouth. Now try to get the air above the tongue. Gently suck it out, just lightly. I don't want you like sucking it hard up there, but you want no space above the tongue. Now take a gentle breath in and sit up tall. Sit up tall. We all try to, we lose our posture when we're on the computer. So gently breathe in with your mouth closed, tongue is up, and gently breathe out. Now, one more time, gently breathe in and gently breathe out. So now in that position, try to snore through your nose. Now, what we need to do is think of snoring not just of airway size. We need to look at it like an engineer. If an engineer looks at a pipe or a tube, they look at the diameter and they look at the flow. One is relative to the other. Now, I don't know if you all have this problem. I bike to work every day and I've got my mask on, right? And if I forget my nasal dilator, because I wear a nasal dilator, and we'll go over that soon too, if I suck in too much, it'll suck the mask into my face. This is the same thing. It's the volume of air, the flow. And if I breathe very gently and very slowly, it doesn't happen. So I need you to understand the flow of air will collapse the airway. And that's one of the reasons why people snore. Okay, now, how do we reduce snoring? The flow and the airway size. When we get the mouth closed, the mouth snoring will stop, which is great. To reduce nasal snoring, we need to bring down the flow of the breathing. We're also going to use nasal dilators, but we're going to practice slow breathing exercises. This will in turn develop a habit of slow breathing. If you reduce turbulence or resistance in the airway, that's what the whole point of slow breathing is to really reduce that resistance. So you're going to practice, put one hand on your chest and one hand on your tummy, your navel. And you want to tune into your airflow in your nose. You want to tune into the breathing that you feel that goes in your nose, down your throat. And then tune into the airflow that goes out of your nose. Now, as you breathe in and out, you should feel, I want you to feel very little. I'm gonna stop share for a second. Okay. So when your hand's here and your hand's on your tummy, the point of the hand on the chest, I want less movement here. I don't want it to be a chest breath. I want it to be a tummy breath. Okay, so that tummy breath, if my hand is on my tummy right here, I'm going to feel it expand and contract, right? So it's going to expand when I inhale, and it's going to recoil when I exhale. So I want you to practice slowing down your breath. Slow down the speed of your breathing to the point that you feel a little air hunger. So I tell people, try to reduce your breathing in, your volume, 30%. When you get to the top of the inhale, I want you to sense a sensation of complete relaxation so that your exhale can be nice and relaxed. But you're still slowing it down and you're still taking about 30% less air in. So you're gently breathing in. You're pausing at the top with a sense of relaxation, and then you passively let it go and you exhale. But I want you to feel a little air hunger. So if you're doing it right, it's not comfortable. It's a little bit uncomfortable. You're like, okay, I feel like I need to breathe more, but I'm going to breathe less. We're all going to get on an air diet now. This is an air diet. We're going to get used to less breathing. Just like we need to get used to less eating sometimes, our bodies need to be conditioned to less breathing. So that's one way, and we'll go into a few different other ways to do this, but I just wanted to introduce that to you. Now, cadence breathing is not Buteyko, but I'm going to throw it in here right now. Cadence breathing is when you breathe. I want you to put your hands on your lower rib cage, the last two ribs of your rib cage. You feel them down here. So I want you to do a gentle compression. When you breathe in, you're going to feel that you're compressing your ribs, but your diaphragm is pushing against it while it inhales. Then you're going to get to a sense of relaxation and passively let go of the compression and let it go back. Then compress it a little bit. Why is it so important to get down there to move? If you're not moving down here, you're not using your diaphragm. Chances are you're using your accessory muscles, which are on your neck. So you want to use your lower big muscle called the diaphragm, that when you breathe in, it lowers. When you breathe out, it comes up. So there's a three-dimensional expansion of your rib cage when you breathe in. But a lot of people don't use that and end up with back problems because the diaphragm helps stabilize the pelvis. There's lots of functions of the diaphragm, but the main one is breathing. So try this. We're going to do cadence breathing now. Hands here. You're going to gently compress. Breathe in, 2, 3, 4. Out, 3, 4, 5, 6. Breathe in, 2, 3, 4. Out, 3, 4, 5, 6. Breathe in, 2, 3, 4. Out, 3, 4, 5, 6. Breathe in, 2, 3, 4. Out, 3, 4, 5, 6. So that is cadence breathing, and it gets you to a perfect 6 breaths per minute. All right, so CO2, carbon dioxide. We're going to talk a little bit about this. You should feel air hunger when you want a bigger breath. That's your body's way of saying, I'm not comfortable with less air right now. I'm feeling like I need more air. That's your body's sensitivity to CO2 because it's actually increasing in your blood. So it's not that you don't have enough oxygen in your blood. You definitely have plenty of oxygen. It's your body's sensitivity to CO2. So reducing your breathing volume in order to increase CO2 in the blood, to cause a reduced increase of chemosensitivity to CO2. You want that reduction. You don't want to be so sensitive to holding on to your breath. We're going to do a bunch of breath holding now. And the people that, if you ever dive and like competed with a friend, like, can you dive underwater and get all the way across the pool without breathing? And one person pops up way before the other. That person that can hold their breath the longest is the more healthy person in terms of breathing. So breathing becomes slow on a permanent basis. That's what we want. So how you breathe during the day will affect how you breathe at night. We need to breathe through our nose and breathe light. Another aspect is, are you breathing fast? Are you breathing slow? Do you know when I took my capnometer, and by the way, I have a machine called a capnometer that this little machine connects to the computer, and this tube connects to one of these little cannulas, the nasal cannula, and it'll measure CO2. These little cannulas will go in my patient's noses, and we will measure breath rate and CO2 levels. And when I first measured mine, I was working on a presentation connected to the machine, and I was at 26 breaths per minute, sitting, not exercising, just sitting there, a little stressed out probably, trying to work things out on my presentation, and I'm breathing. What I want to tell you is that we just saw that 6 breaths per minute was the most efficient. 26 breaths per minute, not efficient. So I was one that yawned all the time, that sighed all the time. That was me. So fast breathing increases the turbulence in your airway. Light and slow and deep does not. Deep breathing causes a lateral expansion and contraction of the lower ribs. Abdominal diaphragmatic breathing causes a stiffening of the throat, and it's less likely to collapse. So the research shows that changing the breathing during wakefulness and rest, it will probably positively affect your sleep. Nitric oxide. Okay, so nitric oxide is a gas that's produced in the nose, in the paranasal sinuses and the nasal cavity. The role that it places on sleep is still not fully understood, but they believe that there's a signaling molecule between the nose and the throat and the lower regions of your lungs, that as you breathe slowly through your nose, you harness nasal nitric oxide. Some communication from nitric oxide from the nose to the throat is what it's supposed to do, and it helps the functioning of the upper airway dilator muscles in the throat. These muscles during the day do their job, sometimes not at night. They become lazy and don't respond to maintain the open airway in some people. So it's also a natural vasodilator and antiviral, antibacterial component. So nasal breathing releases nitric oxide, mouth breathing does not. So it's a healthy thing to have in our system, especially during the COVID pandemic. It will help combat bacteria and viruses that are in the air. And that's only if you nose breathe. Okay, sorry about that. So obstructive sleep apnea has changed over the last 5 years. It's not just about anatomy or size of the airway. There's 3 non-anatomical phenotypes. In terms of the anatomy, the wider the airway, the less resistance to flow, the less turbulence to flow, the less chance of collapse. So the loop gain phenotype, it's basically, there's a stability of breathing during sleep. So these patients tend to have a strong chemosensitivity to buildup of CO2. It means that when you stop breathing during sleep, so say you have an apneic event, your CO2 increases in your blood. If you have a strong chemosensitivity to CO2 in the blood, when you will then resume breathing with an exaggerated ventilation, breathing really hard. So those people that stop and then you hear this big, it's a huge breath. but that's their body is very sensitive to holding on to CO2. Snoring, then when they stop breathing, they resume breathing, strong breathing, they blow off too much CO2. If you lose too much CO2 from the blood throughout the lungs, your brain doesn't send a signal to breathe. So you can actually initiate a central apnea because of that. When the output of the brain to breathe is reduced, the upper airway dilator activity is also reduced. Okay, so we're going to start measuring some. I want everybody to get their phones out and get your timers out. So if you get your clock on and then your stopwatch on, you have it ready because we're going to do some breath holding. All right. So measuring breath hold time, we call that control pause in Buteyko. Loop gain can be measured by breath hold time. So breathe in and out, normal breath. What we're going to do is, I want you to try this. You're going to gently breathe in and you gently breathe out, and then you're going to plug your nose, and then you're going to time yourself, but I want you to time yourself, stop it when you feel a neck jerk or a tummy jerk or your body saying, oh, it's time to breathe. There's another measurement of how long you can hold it, so it shouldn't be the same thing. So the control pause, so gently breathe in, we'll do it twice, and gently breathe out, and we always do it after the exhale. This is counterintuitive because everybody likes to breathe in and hold their breath. This is exhale, then plug, okay? So gently breathe in and gently breathe out. One more time. And gently breathe in. Let everything gently out, normal breath, and start your timers. And see what you get in terms of your breath hold. And what we really want to see, and this is not the easiest thing to measure. When I started this, I was like, what? I don't know when to stop it. So know that if your body jerks, it's like your breathing muscles are saying, oh, it's time to breathe. Your diaphragm spasms. Your throat might spasm. So you need to know and sense that. You need to be able to get to 25 seconds minimum. If it's less than that, you probably have a breathing disorder, okay? So the high loop gain phenotype patients, they can hold their breath 10 to 15 seconds. Okay, so if you have a low breath hold time during wakefulness, it'll affect you how you sleep at night. All right, so there's one thing I wanted to share with you around this article. This is an article that these individuals were actually climbing in high altitude. The effects of slow breathing at high altitude and oxygen saturation, pulmonary and systemic hemodynamics. We're looking at the work of Dr. Bernardi. He's an Italian cardiologist. This actually is not his paper, but it analyzes his work. Looking at the effects of slow breathing at high altitude, that's what this is. So you have these patients that are individuals that are climbing Mount Kilimanjaro. And they, right here, you can see that they climbed 4,559 meters. And when they're doing spontaneous breathing, so they're just checking what their body does, when they're doing normal breathing, their blood saturation actually drops to 80%. So let me see. Let's see. So if you see this, their body, the blood oxygen saturation drops to 80%. Now, which would be considered severe hypoxia. When these individuals reduce their breathing to 6 breaths per minute, they increase their SpO2 from 80 to 89.5%. So understand that just reducing their breathing to 6 breaths per minute, which is what we went over, that was the most efficient way to breathe, they only They increased it to 89%, which is considered mild hypoxia. So there's a second study. Basically, what you have here is blood oxygen. You know what blood oxygen saturation is? You're basically talking about the fraction of hemoglobin occupied by oxygen. Hemoglobin is a carrier of oxygen in the blood and the red blood cells. SaO2 or SpO2 is telling you of all the hemoglobin, how much is carrying oxygen. So you've got study B, an SpO2 of 81. By decreasing the breath rate of 6 breaths per minute, we went from SpO2 of 81 to 88%. It's another slow breathing improvement. So remember what we said from the example I gave you earlier on, slow breathing, you're not wasting that air in dead space. You're breathing lower into your lower lobes where the most of the gas exchange takes place. So that's where the human's greatest concentration is, in the lower regions of the lungs. And so we also have to make sure that we're breathing through our nose. All right, so now, what causes dysfunctional breathing? Stress, number one. If you don't exercise, that's definitely part of it. So you need to get your heart rate going. You need to get your body moving. If you're not doing something, a couple days a week, I try to do something. I bike, I'm active at work. Everybody that here is probably moving a lot, but you're also in these horrible positions sometimes. And I'm sitting, when I sit, my sit like this, it's not great. Where is this? So I sit with my head forward over patients' necks, and I'm looking down at them, and this is not good. So I've got to do a lot to correct my body, and it's a continuous thing. It's not like you do it once and it's good to go. You have to continuously work on improving your alignment, especially you dentists that have to look down like this. And the dentists I work with, they all have a rotation of their upper neck because they're always in that rotation position. And if you can use whatever you have to keep your head over your neck. And if it's not possible, we'll go over what you can do next week. That our next time we meet. I know that we're not meeting next week, but the next time we meet, it's all neck and exercises to improve mouth position and spinal posture. Okay, so lack of exercise, bad habits, overeating. Overeating makes you breathe too much. Multiple breaths per day, throughout the day, big breaths, big talking, a lot of talking. If you're a talker, you're probably blowing off too much air and sucking in through your mouth, so beware. Setting high temperatures in the household is really also a problem with overbreathing. And you've got genetic predisposition, and also asthma obviously affects your breathing. But the shape of how are we shaping up these days? Like, we're not hunters and gatherers anymore, right? So we're not using our body to gather food, and everything is very accessible, and we will, eat on the run. We're not sitting down and enjoying our meal and savoring our bites and eating slow. A lot of us don't even pay attention to eating. It's just like eating while they work. And the past 3 years, I've been really working on this, but I challenge you to really give yourself that time. You deserve it. I lived in Europe. I lived in Amsterdam for 3 years, and when I was studying physical therapy, and they make you take coffee breaks twice a day, 15 minutes, and you cannot bring work, and you cannot really talk about work, and an hour lunch. And it's just mandatory, and you do it. And people are just a lot more present. I don't know. I really enjoyed living there. Okay, so what's the primary stimulus to breathe? Three things: carbon dioxide, oxygen, and pH levels. All right, so when CO2 increases to a level of a certain amount, the sensitive receptors in the brain will stimulate breathing to get rid of that gas. So the primary stimulus to breathe is to actually eliminate CO2. So breathing more than what your body requires over a 24-hour period actually conditions the body for increased breathing. So I always ask people, if they're coming to me for help for breathing, is if they ever experience a stressful moment, an injury, a car accident, a devastating death, or maybe a breakup that was like made you miserable for a month. So that change normally gets internalized by our breathing. So you want to make sure that you realize if you breathe poorly for 24 hours, your body starts to change its way of breathing to that breath rate and that pattern. Okay. So CO2 is not just a waste gas, actually, where we need it. We need certain amount in it. And when I use my capnometer, I'm hoping that all my patients are at about 40 millimeters of mercury. That's when your body works perfect. So pH, our body is always trying to find homeostasis, trying to find a balance. When you are at a pH of 7.3, that's normal. If you want to go, your body will allow certain amounts of acidity and alkalinity, which means that if you go too far one way or the other, your cells will start to die. So it's important that our body uses its way of changing the pH. A lot of times is through breathing. So the oxygen dissociation curve is the Bohr effect curve that shows saturation of oxygen and PO of oxygen here. And basically all this is saying that if you increase CO2 in the blood, it causes a right shift of this curve. And it causes the hemoglobin to unload in the oxygen it is carrying. Therefore, over-breathing will cause us to actually reduce the oxygen to our tissues and our organs. So a lot of people have this thing that they feel breathless and they feel like they need more oxygen. It's not that. Your oxygen, if you took a pulse oximeter and you put it on your finger, and during COVID, you want to, if you have symptoms, get that thing out, because if your oxygen starts to drop, that might be a sign that you have been infected. But know that in these cases of people feeling breathless, they have plenty of oxygen. It's their CO2 that's low. So when their CO2 is low, the hemoglobin and the oxygen bond that is created when you breathe, it stays so strongly connected that it's not allowed to disassociate and actually oxygenate the rest of the tissues, especially the brain. And the brain will cause you to feel anxious when you don't get enough oxygen. Oxygen, now guess where the muscles actually produce CO2. So if you're an athlete and you're a mouth breather, you actually might compensate by exercising and building up CO2 in your body because of exercising. So that's why even mouth breathing athletes don't have as many symptoms as the average person on the couch not moving. Who has cold hands and feet? I used to, and I do, if I'm mouth breathing. So I'm not perfect. Remember, I'm a breathing patient too. So I'm doing the best that I can all the time. I try. But when I'm cold, I'm like, oh shoot, here I am. And I start checking my nose. My nose is stuffy. So know that that's a sign that you're probably mouth breathing. So breathing a volume of air greater than your metabolic requirements results in the diameter of the arterial blood vessels to reduce as much as 50%. So this reduces the circulation. Whatever's farthest away from your heart is your hands and your feet. So that will cause them to get cold because it's a longer distance, and the diameter of the arterial blood vessels will reduce, causing it harder to get to those areas. So this is a typical craniofacial development mouth breathing patient. You can see that they grew very long-faced. And you'll notice that the jaw is recessed here. And she's got a lot of tension in her chin to close those lips. She probably has a pretty gummy smile too. And notice her face, there's some asymmetry in her face, that this eyebrow you see is a little lower. Her eye on this is a little lower. Her ear is a little bit lower on this side. And you want to make sure that you're looking at these asymmetries. One of the things we do in my practice is cranial osteopathic manual medicine. So you can actually affect the cranial sutures. And patients that are mouth breathers tend to have that very high narrow palate and a bent nose. Children, this looks like a nice normal kid, right? This is a mouth breathing kid. And notice you can see a lot of teeth. When you see that much teeth, that's not good. Your lip should cover 3/4 of your upper teeth. And if it doesn't, you have always, anytime you're closing your mouth will have to, your chin, your mentalis will have to work hard to close that mouth. And anytime you have tension, each time you close your mouth, you'll develop facial tension. Facial tension ends up developing facial pain eventually, muscle pain. So these are the Buteyko clinic. You got the control pause. We're gonna do that one more time. We're going to unblock our nose by doing breath holding. We're gonna try to switch to nasal breathing on a permanent basis. And we're gonna reduce breathing volumes to normal. And we're gonna have various lifestyle changes. So this again is the control pause. Remember, you're gonna take a silent breath in and a silent breath out. Nice normal breath, not a big breath. You're gonna plug your nose, and then you're gonna count the number of seconds it takes for you to need to breathe. Let's try it. So I want you to gently breathe in, get your timers out, and gently breathe out. We're gonna exhale one more time and plug our nose. Gently breathe in, and gently breathe out. Get ready to plug and plug your nose. Time yourself. And remember, you're gonna stop when you feel that distinct desire to breathe, your neck jerk or your tummy jerk. And when you unplug, make sure your nose breathe too. And it should be a normal breath. Shouldn't be a big breath. We're gonna do it one more time. It takes a little bit to figure out. So know that 25 is kind of the minimum to be normal. Okay, so if you have less than 25, you're probably over breathing. And I was there too, and I'm at a 32 now. So, and I've been doing this for like 9 years. So, but I started at 16. So just know that you can improve it. And I'm still trying. Okay, gently breathe in and gently breathe out. And try not to sigh and try not to yawn. And gently breathe in. Let everything gently out. Get ready to time and time yourself. Remember that neck jerk, tummy jerk, you're gonna feel it and you stop it because we're gonna do a longer breath hold soon. And mouth closed afterwards. You know, I tape people. I tape people because people are like, they start to open their mouth. They're like, oh my God, I gotta breathe. And I tape them. Just know I was there too, so it's okay. So what's the significance of this? Okay, so less than 20, you probably have a symptom of like a blocked nose, snoring, insomnia, sleep apnea, fatigue, coughing all the time, like clearing your throat, wheezing, breathlessness, even exercise-induced asthma. Between 20 and 40, your symptoms are basically gone, except for triggers. So my trigger is red wine and like cheese. That will stuff me up in chocolate. Does that mean I don't have it all the time? I will still have it. And I will have to pay because I will get stuffy. But those are triggers that I know, and you probably know what your triggers are. You have to decide whether or not to avoid them. So food plugs us, and food is a trigger. All right, so your CP, you're going to gently breathe in. Someone with low CP breathes like this, kind of like up and down, not ever the same, erratic, you know, big breaths. Someone with a CP of 40 breathes nice and calm and gentle. They're an even keeled person that is nice and relaxed. Okay? So next exercise, decongest the nose. All right, so now you can only do this if you don't have cardiac problems, like if you had a history of a heart attack, a stroke, high blood pressure. If you're pregnant, I should put that. If you're pregnant, don't do this. Long breath holds. Holding your breath for long periods of time will cause a vasodilation of the blood vessels that may be too aggressive for individuals that have heart concerns. Instead, try taking a walk with your mouth closed to unblock your nose. So here we are going to decongest our nose. So get your phones out again. This one's a good one. I do this when I watch movies, and I've been watching a lot of movies because of COVID with my kids. So decongest the nose. You're going to breathe in and out of your nose. You're going to pinch your nose, and you're going to hold your breath as long as you possibly can. What I ask people to do is kind of sway to distract themselves. So you're going to sway and distract yourself to kind of try to hold your breath as long as possible. So what I want you to do is, ready? Gently breathe in. Close your mouth. Tongues are on the palate. Gently breathe out. Gently breathe in. And gently breathe out. Get ready to plug, and plug your nose after you've exhaled. And sway. This one you're going to kind of sway. You can close your eyes if you want. Just keep saying to yourself, I can relax. Hold it a little bit longer. When you need to breathe, then you nose breathe. Keep your mouth shut. And if you have tape your lips. But you want to hold it, hold it, hold it. And it's going to be a big breath. I'm going to let you have 3 big breaths. After the 3rd breath, get it down to a normal breath. So we're going to wait 30 seconds and we're going to do another one. So you do 5 in a row and it unplugs your nose. If you're sick and you're miserable and you keep blowing your nose and it's still stuffy, this exercise will really help you. So you're not trying to deprive your body of oxygen. That's not the point here. Instead, you're trying to normalize your breathing volume. Air shortage during reduced breathing is not due to a decrease in oxygen, but an accumulation of carbon dioxide. Okay, so let's do it one more time. I'm gonna go back. Gently breathe in and gently breathe out. Let's do it on the 2nd exhale. Gently breathe in. Let everything gently out and get ready to plug and start your timers. Go. Sway. So I always try to beat my last score. And I close my eyes and I tell myself, okay, relax. You can hold it a little bit longer. Your body's not going to like this, but it's opening up. CO2 is a natural vasodilator. So 3 big breaths, and then after the 3rd one, it should be a normal breath. So that's, if you're holding it too long, it takes you longer than 3 breaths to calm it down. That's too much of a breath hold. Like, I don't want to overdo it. I want your body, and listen, I'm going to stop here for a second. Some people are anxious, right? I don't know if this causes you anxiety. If it does, you can't do the breath holds that long. You can't. You got to start with where your body's at. Your body has been conditioned for years a certain way. And what I'm trying to do is get you uncomfortable, because that means you're actually doing something to change it. If you're really comfortable doing it, it's not going to change your automatic function. So you need to feel uncomfortable to actually get things to change, but you don't want to push it that you become anxious and then breathe big afterwards. So that's not the point. All right, so, okay, we're almost done. There's another exercise group is called reduced breathing exercises. So we talked about the ones here where you're here, you're squeezing and you're slowing down and you're reducing at 30%. Now there's a couple more. Try the finger under the nose. So you're just gonna gently breathe in and you're gonna gently breathe out hard once. Do you feel that air on your finger? Think of your finger as a biofeedback machine. Now pretend there's a feather on top. Gently breathe in. Now exhale so lightly that you almost can't feel it on your finger. And then pause at the bottom, gently breathe in again, nice normal breath. Pause at the top, exhale so lightly, so gently that you almost can't feel it on your finger. So your finger is telling you how much volume you're taking in. Now you should feel that your chest is not moving too much and that your belly is breathing in and out. I like this one because I can sit anywhere, kind of think. It looks like I'm thinking. You know, I'm trying not to lean on my chin though. Don't lean on your chin, that's bad for your jaw. So finger here, you're just thinking. And you're feeling. And you're monitoring. Is the air going like this? Is it blah, blah? Is it going like that? That's too fast. Okay, remember 6 breaths per minute. That's all we want. So we need to slow it down. So it's a sensor to feel how often you're breathing and how, is it a big volume? Is it just blowing out on your finger? So that, I like using my finger. Now some people that are super, super low in CO2, let me see. Let me go back. This is not exactly it. So cup your hands around your face. So my patients that are really low, when I do the capnometer and they're in like, I had one patient and she was hyperventilating, had a vestibular problem where she was dizzy. She was at 15 millimeters of mercury. We want the CO2 levels to be at 40. 45 is great. So if you cup, and that patient, you pull CO2 when you cup, right? So cup around your nose, breathe in, exhale strongly through your nose. Do you feel that air, that you feel the warmth, right? So you want to gently breathe in. Now exhale so lightly, so gently, you almost can't feel it on your fingers. Okay, so that's the whole point of this, is gently breathe in. You're using your hands as a sensor. You're using your finger or your hands. But I want you to keep your hands there. You're going to gently breathe in and you're going to pause at the top. You're going to exhale so lightly you almost can't feel it on your hands. You're going to pause at the bottom. You're going to gently breathe in. You're going to pause at the top. You're going to gently exhale. You're going to pause at the bottom. So if you breathe like I was at 26 breaths per minute, that's already going to slow you down. Is it going to feel comfortable? No, but you have to work on this. Stress makes us breathe fast. And if you are stressed out a lot, chances are you're breathing fast all day. And guess what? It makes you go into a fight or flight system. You do not want to be on a fight or flight nervous system all day, all night, because you're going to breathe fast and you're going to be anxious. So we want to create a slight resistance to your breathing. We want to slow down each breath, take in less air than what you would like to. You also want to make the breath in shorter and smaller. You want to breathe out more relaxed. You want to imagine like a balloon slowly deflating. You don't want to deliberately tense your chest or your neck muscles or your belly. You want to create an air shortage that is tolerable and not stressful. If breathing gets faster, becomes jerky, or your diaphragm spasm, that air shortage is too much. You want to just stop what you're doing, take a break for 10-15 seconds, and then return to it. So this is an example of someone going out of control with breathing. They're inhaling, they're exhaling. This is their normal pattern. And then they start to reduce it, try to slow it down. And then they freak out that that's too much. And then they big breathe. And then they, it's chaotic. So we want to address breathing. And it should be very natural. We cannot force breathing into place. We can only encourage it. And we want to breathe slow and reduce it through mental commands and encourage it and relax your breathing. The need for air should not be stronger than the end of your controlled pause. So what does that mean? Your end of your controlled pause, remember when you stopped when you felt a neck jerk, tummy jerk? That should be how you breathe after you do this exercise. It shouldn't be like a panic. Some signs that you might look out for that you do with reduced breathing is some people have a sense of calmness, some people have a sense of panic. Some people's eyes go glassy, sometimes people have like increased saliva in their mouth, their nose might run, their hands might get warm, their face might get pink. All right, so before I do this, has anyone ever done Buteyko? And if they have, I'm going to stop share for a moment because I normally do 3 sessions of my breathing clinic, and the steps is normally in session 2, but I'm going to make Buteyko all in one, so I'm stopping right now. I'm going to show you, and I invite you to stand up. You don't have to. We're going to do a walking exercise. If you want to try it with me, please do. It's called steps. So what I want to show you is that you're going to be walking. Okay, so, and when I walk, I want to lift my sternum. I want to bring my shoulders back. I'm going to move my thumb should be facing forward, and I'm just slowly, I'm walking in place, but I normally walk around my park. We have a park right outside that has a circular path. So I'm not walking like this where I'm not moving. I want you to know that your body needs full movement. So start walking. And we're going to gently breathe in and out, right? Same way. We're going to exhale and we're going to plug just like we have been. And what does that do? What we want to do is we want to plug. What does it do when we do all these breath holds? It accumulates CO2. That's what we're trying to get desensitized to holding on to so that we breathe less, right? So here's the steps. You're going to gently breathe in and out. You're going to plug, then you're going to count. If I do steps, each step is 1 count. So 1, 2, I'm plugging my nose. I'm counting. How many steps can I take before I need to breathe? Okay, that's the exercise. So gently breathe in and gently breathe out. Gently breathe in and gently breathe out. Last one, gently breathe in. Let everything gently out. Get ready to plug your nose. Count your steps. So you're going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. When you need to breathe, you unplug, you allow yourself to have 3 big breaths, and then you return to a normal breath rate. And you keep walking with your mouth shut. Many people in I retreat need to be taped because their mouth opens. So we'll do 2 more. So you're walking. This is to increase your sensitivity to CO2. You're walking, you gently breathe in and gently breathe out. Gently breathe in and gently breathe out. Last one, gently breathe in. Let everything gently out. Get ready to plug and plug your nose. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. When you need to breathe, unplug, keep your mouth shut. Let yourself have 3 big breaths and go back to a normal breath. Okay, so that is the exercise of steps. I'm going to stop for a moment. I'm going to have everybody sit down if they want to sit down. Understand that when I do this, I get leg pain in my thighs. It is, and I'm walking fast. Okay, so right now when I'm doing the video or the recording, it's not exactly doing it outside or on a treadmill. You could totally do this on a treadmill and spend 10 minutes before you work out on a treadmill, and that'd be perfect. So you're walking, you're exhaling, you're plugging, and you're counting 1, 2, 3, 4, 5. So you're going to die when you hear what the goals are for adults. So let me see. Oh, you know what? It's in the other presentation. So sorry. So the goals for adults are 80 steps, okay? 80. So I've gotten to 70 a few times, but I'm normally in the 50s. 80. And for kids, because they have littler feet, is 100. So just know that this is a great exercise for you to do. If you go to the gym, spend 10 minutes doing breath holds, walking, steps. That's the most efficient way to use your time to improve your breathing and improve your volume. We're all trying to make sure that we adjust how much volume goes through our body. All right, so let's talk about tape real quick. This is 3M micropore tape. This has changed my life. Taping, I used to snore a little bit. Don't snore anymore. I don't wake up in the middle of the night. Used to go to the bathroom 3 times. Don't do that. I might go once, maybe. And this has changed everything for me. So you want to wear paper tape. And I will normally, if you buy 3M micropore, it's just simple paper tape. I normally fold a tab at the end of the tab for easy removal. And then I'll put it on the back of my hand once, and then I'll place it right here. So just know that if you put it directly on your lips, it's fine, but it's a little sticky. So if putting it once here and then here, that's better because it's not as sticky. Some people are a little nervous about wearing tape, which, you know, everybody's different. I've been taping my children. My daughter was 5. My daughter was 4, and my son was 5. Now I'm, you know, when I first learned about taping, it was really scary. My husband wanted to kill me that I was going to tape my kids. They're the reason I really got into this field, because they had swelling in their tonsils and adenoids, and they were mouth breathing. I didn't even know. But there's another tape that I'm going to show you that's new off the market. Somnifix is another great tape. This is actually hypoallergenic. It's made, there's a silicone base to it, so it's soft for the skin. For anybody that's worried about wrinkling their skin or pulling, this is perfect. And it has a little hole in it, so you could breathe through that hole. Okay, now myotape, and now this is the new tape. You see how that has a hole in it? And it has it's kind of like kinesio tape, if you ever use kinesio tape, but it recoils. There's a tension to it. So you're supposed to stretch it 30%, and you put it and what is it doing? It brings my lips together. Now, my kids, I bought a bunch, and you can get this at myotape.com, and I'll go quickly over the supplies at the end. This comes in children's sizes, which is just small, and then adult. So this works great. So if you're scared of taping, use one of these. It's awesome. And like, I'm so happy that this was created, because I have so many parents not too scared to tape, right? And it is scary. Okay, I get it. But once you realize it's just, why are we doing it? Nose breathing. It makes your mouth close, right? So your nose is going to be the only one working. Now, let's see. Okay, so there. Okay, so what happens when you're blocked in the nose at night? One thing you could do is steps right before bed. That unplugs your nose. You also want to rinse your nose with sea salt water. This is in the supply list. There's a couple things I want to share, and I just brought. NeilMed has these little packets. I love them because they're easy to travel with. This is called the Nasaline. It's a nasal, it's basically a sinus rinse. So you put one of these packets in an 8 ounce cup, and you put the sea salt in it. You create the syringe, and you suck in all of the sea salt with distilled water or boiled water or reverse osmosis water, and you put it up your nose over the sink, and it goes in one nose, out the other. I will always rinse my nose with either this or the NeilMed bottle. And then there's one more. I learned this. This actually is a saline bottle. You can get them at any Walgreens, but I have the link that I'll go over. You can take the bottle off, the top of the bottle off. I recommend that you not actually use what's in it, and that's just, it's saline water, but there's some preservatives in it. I put some sea salt in it, and if I were using this, I'd use a third of this. And by the way, I can send Katie the email explaining what I said. Whenever I do a breathing clinic, I always send a follow-up exercise description so you have it. So this jumpstarts your brain. It wakes you up. It fits perfectly all the way to the top of the nasal valve here. You tilt your head back, you breathe in twice, and for some reason it's leaking. You do the other side. So I'm breathing in, sucking in air, and swallowing. All right, so I told you, I used to not clean my nose at all. And now, at least twice a day, I clean my nose. I used to mouth breathe all day. I don't mouth breathe anymore. Why? Because I'm treating the inflammation in my turbinates. I'm treating my nose. Then you got this, it's called a neti stick. There's another link for this. It's natural lavender, menthol, but you put it in your nose, you breathe in, it's amazing. I have this in my pocket all the time to open up my nasal passages, and if you have sleep apnea, this actually wakes you up. And if you're tired at work and you're at a meeting, you stick that in your nose and you wake up. All right, so we talked about cleaning our nose. Let me go back to this. Wearing tape and the breathe rights. Please do not tape without any kind of nasal dilator. I please urge you to use a breathe right strip to open up your nasal passages. And when you take that thing off, I don't think I have one right here, but when you take that and you stick it, get the extra strength. The extra strength is better. You want to place it right here, and you have to mess with that thing. So I press it like 30 seconds, and I keep pressing because I don't want the sticky part, and you have to really have a clean face, so wash your face. And don't put cream right here, that'll make it not stick. So you want to mess with it, and then when it lets go, it lifts the nose walls, and it creates an open nose. So your nostrils you're bigger. So that's how I want you to tape. Tape your lips and have this on. All right. And I think, so if you can't breathe through your nose, go see an ENT. Honestly, go see an ENT. You want to be able to breathe through your nose. If you can breathe through your nose for 1 minute, you can breathe all your life. You can nose breathe. If you cannot breathe through your nose for 1 minute, you got to see an ENT. You got to check it out. Go get a cone beam, see what's happening in the nostrils, in the nasal passages. So a busy adult, this is the Buteyko program. You want to wake up in the morning and reduce your breathing. 5 minutes. Start with 5. You, for example, when you're lying in bed for a few minutes, reduce the breathing and create a need for air. You want to start your day with less air. At lunch, take a 20-minute break. Walk with your mouth shut. Do these little breath holds that we were talking about. And when you're doing them, if your steps are too aggressive, you end up doing, instead of doing steps that you push it as far as you can, do 10 steps and then breathe through your nose. Wait 30 seconds and do 10 more steps. So instead of pushing it, it depends on your anxiety level. If it's too much, I don't want to hear that you're not doing it because you're nervous to do it. Lessen your breath, your reducing of the breathing. Ideally, you do 20 steps. If you really want to improve sleep apnea, improve your asthma, improve overall mouth breathing, this will really regulate the volume. Ideally, you spend about 90 minutes a day reducing your breathing. It's formally 10 minutes per hour. So the next week or next session that we're going to go over is basically going to be myofunctional therapy and posture. The last session will be some nervous system exercises, the Lois Laney restorative breathing method to reset the autonomic nervous system. And then we'll go over anything, I'll kind of do a summary of what you've learned over the 3 sessions. And even someone that wins the marathon can nose breathe at the end of it. So it's possible. All right, so I'm going to end share, and then I'm going to just show you the supply list real quick. We got 2 minutes. That's not it. Katie, can you see books by my mentor, Patrick McNone? Do you see that or no? I'll do it again. So I might have moved it. Hang on. Do you see it now? Books by my mentor? Okay. So, all right. So these are books that I'm going to send Katie supplies and the summary of today, okay, with notes. I want you to know that the Close Your Mouth book, that's, if you really want to work this, it's the best one for reviewing Buteyko. The Oxygen Advantage is for more the athlete to get to the next level. If you need asthma, a book on asthma breathing improvement, that one. Sleep with Buteyko, that one. Breath by James Nestor, awesome book. I actually I interviewed him. I will put a link to the interview if you want to listen in. He was amazing. This guy he's a journalist that did a study with Stanford where he plugged his nose with silicone plugs for 10 days. It caused sleep apnea. 10 days of mouth breathing caused sleep apnea. Interesting. For children, if you want to learn more about this book, Jaws by Sandra Kahn, very good book. Now, supplies, 3 different tapes, or actually, no, 4 different tapes. 1, Myotape, 3M Micropore, Somnifix, and West Gen X tape. Those tapes are all, I would try, the cheapest one is this one, and I'll use that forever because I don't need anything more. But the Myotape is that orange one with the mouth open. Somnifix has that little vent. West Gen X is just a little cross. And then if you are scared of all that, you can use a chin strap. Nasal dilators, there's 3 of them. I'd get all 3. If you can't use your nose that well, if your nose is narrowed or you have a bent nose, get all 3 and see which one you like better. The inhalers, try all three of these. The white flower I use more for when I'm sick and in bed. I'll put it here and I'll have my arm next to me. My kids will use that. The other ones were what you saw, those little, the little inhalers that you use in your nose like this. Now the nasal spray, you see that you've got the saline, the nasal line is this syringe thing. The Neomed rinse is the bottle. The sea salt is the little packets. And that's it. That's it. So I'm going to share with Katie all of this information, and just know that every week is a different set of, information. And I hope you really learn something and that you get a little healthier after you try some of these exercises. If you need any help, please reach out. You can always reach me at thehobsoninstitute.com.
Awesome job, Jennifer. Thank you as always. I always enjoy your lectures. And sorry, I was running a little late, but I was stuck in the clinic earlier today.
No problem.
Yeah, so I appreciate it. And for those of you who are wondering why we're doing this, because a lot of our patients have these problems. And a lot of us have these problems as well. And nasal breathing, it does make a big difference in your overall health and your disposition, if you will, because kind of like you said, you would feel more even keel and more balanced during the day. But I gotta admit, it's not easy to learn. I read the Oxygen Advantage by Patrick McEwen, which is the reason I got interested in it, because I do a lot of endurance sports. And it's great. I tried to do it for one of my Ironman competition, but it takes a lot of practice. But there is definitely a clear benefit that you can get out of it. For those of you who have like nasal obstruction, kind of like I got my niece. Where is Mona? Mona Asha is my niece. She always has nasal obstruction.
Hi.
Hey, honey. So I'm glad you got on the lecture, because that's something that's very beneficial for her. Asthmatics, sleep apnea, the patients that we treated, the reason why they have it, because their dentition is all messed up, and it's because of, they've been mouth breathing ever since they were children, and it does affect your teeth as well. So there's a lot of good benefits of it. And I definitely like the way Jennifer teach these things, because it's easy, straightforward. You really have to be a believer before you start trying to do these things. So thank you so much for doing this. I think it's for the benefit of all of us, our referring doctors, our patients, and for us as well. So that was great. Thank you. I'm looking forward for the next 2 lectures.
Thank you, Dr. Katabi. I really appreciate the opportunity. This is so fun for me, and I'm glad to share this with your group. They've been so welcoming and great to me. Thank you.
Awesome.
Okay.
All right. So this is it. Next lecture, I think it's on the flyer that we send you all. And I think Katie, she posted the note. When is the next lecture, Katie?
Yeah, so it's going to be Tuesday, November 3rd, and then we have another one on Tuesday, December 8th. And then everyone should receive their CE sometime tonight. If you don't, please reach out to me via email, and I'll go ahead and share the paperwork that Dr. Hobson will be sending me as well.
Okay. And a quick comment, November 3rd is election day.
Yes, so vote.
So we were thinking, yeah, definitely vote before you attend the lecture. But we were thinking about like changing the date, but we figured, with the COVID, lots of people are doing mail-in ballots, and, we're going to do the seminar at 6 o'clock. So there's not going to be too much exciting news by 6 o'clock. Hopefully we'll find out the results by 10 p.m. if we're lucky. If not, in December.
Yeah. Okay.
Hopefully not. All right, very good. Anything else, Jennifer?
No, I'm just, what I say is get the supplies. I'm going to send the list, and don't let this be a faint memory. This is real. Everybody has breathing issues, so try these exercises, and please reach out to me. My email will be on, the notes. So if you have problems, if you have questions, I'm here to help you. Okay. Thank you so much, Dr. Katabi.
Thank you so much. You guys all have a great night. Bye.
Bye-bye.
Thank you.